Dr. Parrott here. So, why am I a dentist? Well, pretty simple story. I wanted to be a great dad. Third grade, I still remember them asking me, hey, what do you want to be when you grow up? And I said, I want to be a dad. And I said, well, that's not really what we had in mind. We were thinking like fireman, doctor, lawyer, something like that. And I said, astronaut. And I said, no, I want to be a dad. I want to be a great dad. And I have a great dad. And he was a dentist. So I just naturally linked the two together. So my whole time growing up, getting the dental chair was just super easy. I would jump in the chair. He had the chairs that I could adjust right here behind my head. I'd lay the chair back myself, and I would usually, or a lot of times, fall asleep. Not because he would give me gas or anything like that, but I was just so comfortable I'd fall asleep and let him work on me. Matter of fact, I was so comfortable having him work on me that I didn't bother to brush my teeth because what was the point? Dad was just going to fix them anyway and it wouldn't hurt. He did threaten me that if I needed another one, that because I was taking such bad care of my teeth, he'd do it without anesthetic, and that was a new motivator. But I always just had great dental care and couldn't understand why people didn't like to go to the dentist. Then when I was in college, I had the opportunity to be worked on 1 week by my dad and the next week by somebody else. Dad just didn't have time to do all the work that I needed, and I went to somebody else and had an excruciating, horrible, terrible experience. It was bad every step of the way. The getting numb hurt. They were jerking my face around as they were working on me. I'm not even sure I was numb when I got worked on. It was just horrible. So I decided, hey, the world needs more dentists like my dad and less dentists like this guy who was what I guess everybody else experienced. So I went back, changed my major, changed it from computer science. Also didn't relate real well. I had missed an episode of Star Trek and could no longer talk to the rest of the guys in computer science, and I could not find a pocket protector that I liked. So I didn't fit with the computer science gang very well. So I went back, changed my major to pre-dental, and have loved it ever since. Just love taking care of patients, love proving that it doesn't have to hurt to go to the dentist. It doesn't have to be uncomfortable, that you can have fun, you can be personable, and it's fun to be taking care of patients. So that's why I'm a dentist, and that's why I love being a dentist, and that's why I love teaching others to love to be a dentist, because when you take good care of patients, you can go home at night, sleep well, know that you've done good for people, and just have a great time doing it. Not everybody's going to like me, and that's fine. My personality isn't for everybody, but that's another thing I come to grips with is I like to be fun-loving, lighthearted, and enjoy myself. And so I just do dentistry that way too. Since I'm not going to hurt you anyway, then why can't we just have fun and be friends? And so I think that kind of summarizes why I'm a dentist, or why I became a dentist. I stayed a dentist because I love it so much. And I'll keep doing it as long as I'm having fun. Thanks for listening.